Well, I'm here to talk about fertility treatments in Cyprus in general. Today is going to be like a little bit of an introduction of what we do, why choose North Cyprus as a destination for fertility treatments. And I will just share some information about what we do here and what kind of treatments we offer and so on and so forth. But today I'm not going to go into detail of any sort of treatments. I've reserved that for our next talks because we're going to have a series of talks with you guys. So what I've done is I've prepared some PowerPoint presentations for those talks as well, where I'll be talking about specific treatments, for example, stem cell therapy in fertility or PRP treatments. Aisha from the Thermal Resort just talked about PRP treatments and the applications that they offer. And we do offer PRP treatments in the fertility field as well. And it's one of the up and coming treatments in the fertility sector. So I will talk about different types of treatments, some out of the box treatments as well. But today I will just go ahead and introduce Northern Cyprus as a medical tourism hotspot. And in terms of fertility treatments, what we offer, and why North Cyprus is actually a hotspot, why it's a preferred destination. I would like to talk about those. So I'm just going to go ahead and share my screen so that the presentation can be seen by everybody. Are you able to see this?
Yes, we do. Go ahead.
Okay, perfect. So as I said, today is just a very brief introduction in terms of what we do here in Northern Cyprus. I've prepared this very, very short, brief PowerPoint presentation, and I will just go ahead and talk about the basics. My name is Ahmet, and I'm one of the physicians at the Elite Research and Surgical Hospital in North Cyprus. We're associated with the Cyprus Healthcare Council, and this is the first time I'm actually representing us in this platform. So this will be a first for me. So I'm happy to be here. And just to give you some background information about fertility treatments in North Cyprus. Our hospital was the first hospital to introduce IVF treatments, introduce fertility treatments in Cyprus. And that was back in 2001. I was not a physician back then, too young for that. But we opened up in 2001 and we've been offering fertility treatments since 2001. So it's been 20 years, 20 plus years of experience. And a large proportion of that is to cater international patients. So we've been a very active participant of the global medical tourism in the field for over 20 years. So that grows every single year. And one of the main attractions of Northern Cyprus in terms of coming for IVF treatments is the ease of travel, because we do not have very strict visa requirements. And it's relatively easier for people from the Middle East, from the Balkan region, to travel to northern part of Cyprus, because we're not in the Schengen region. Like the US or the EU, we don't require strict visa requirements. So it is relatively easier to fly out to Cyprus, Northern Cyprus, and come for treatment or make a vacation out of it. And obviously, one of the benefits is that it's sunny all year round. It's actually too sunny in August. So if you're planning on coming in August, think again. But otherwise, the rest of the time in Cyprus, in Northern Cyprus, is beautiful. It's a very good vacation spot as well. So that's one of the benefits for people, because when you're traveling for treatment, it can be very stressful. It can be overwhelming. But at the same time, if you're able to combine it with some sort of a holiday time, vacation time, it's something that makes it more tempting. It helps you relax a little bit. Just like that beautiful thermal resort that we just saw. Like there are a lot of nice accommodation options here as well. So people do travel here for holidays. So if you get to experience that as well, combine it with treatment, that's something that helps you relax while receiving this treatment, because fertility treatments are they involve hormones, they involve a lot of things. So it's like an emotional roller coaster, because maybe you've been trying to conceive for some time and you've been unable to do so. Maybe you've received a number of treatments previously and they just all failed. So you're flying out to a new destination, you're flying out internationally to receive this overwhelming treatment. And it's not easy. We think, because we've been offering this for 20 plus years, we think it's relatively straightforward. It's easy. You hop on a plane, you come here, you receive your treatment, you get pregnant. But for the people receiving that treatment, it's not that straightforward. So why should people choose North Cyprus? First of all, as I've mentioned, we have 20 plus years of experience. And what that means is we've been offering this for 20 plus years, and we've been offering this to international patients 20 plus years. So we are very used to offering these services in a satellite manner, where we have established contacts with a lot of doctors, a lot of hospitals, a lot of clinicians all over the world, in the US, in the UK, all over Europe, in Turkey, everywhere. We have established ties with physicians where the patients can receive their initial treatments locally. They can prepare in terms of their taking their medication, in terms of seeing their physicians for follow-up. They can prepare initially and come to Cyprus, come to North Cyprus to finalize their treatments in a matter of a week. So they can stay here in North Cyprus for about a week and finalize their treatment. So that's a huge benefit, because not every person has 3-4 weeks to spare to receive treatment. So that makes it easier for patients. They would be under our supervision, they would be under our monitoring, but they can have those initial ultrasound scans or the initial injections locally. So that makes it more appealing. And it's affordable. Compared to the US, compared to the UK or EU, North Cyprus is much more affordable in terms of fertility treatment prices, because of the exchange rate. We do use Turkish lira here as well, just like in Turkey. And since we use Turkish lira, with the exchange rates, it is very favorable for people who earn euros or dollars. So we would be offering these treatments at a fraction of the cost of what they do cost in the US or in any other part of the world, pretty much. And because we're very used to offering fertility treatments for international patients, we do have a large establishment. We do have a large hospital. We do have a number of patient coordinators. We do have a number of physicians. And essentially, that means no waiting list. If you are a part of NHS in the UK, for example, to be able to get treated, you could wait up to a year. And that's a long time, especially when you're considering your biological clock. To wait for a year or two, it's a long time. And often people are not very happy with the services they receive with the NHS because it's a substandard service. It's free of charge, but most of the time people just opt out of the NHS and just come privately to us because they just don't think it's worth it, because they're not receiving a great level of care and they're just done with it. So the establishments here are the level of technology used. It's state of the art. And people see that. And because it's international patients that we cater to, we pay extra attention to their accommodations, how they are received here, how they are welcome here. And they each have a patient coordinator that organizes everything for them. So it makes it a little bit easier. People do feel special. People do feel like they are being heard and they are being treated properly. So these are very, very important for people, especially when they travel for a specific treatment. We do offer a number of treatment options, and some of these are the conventional treatments that everybody's been offering for some time. And some of these are a little out of the box treatments that we have devised over the years, because fertility treatments should not be just one thing. Every single patient is different. Every single patient's treatment requirements are different. So you cannot just offer one prescription to all patients and expect that it'll work for them, because there are women at the age of 35 who've entered premature menopause. There are women at the age of 42, 43 with perfect ovarian reserves. So it's not one size fits all. So you have to approach every single patient independently and individually, and then see what kind of treatment is most suitable for them. For example, artificial insemination, also known as intrauterine insemination, IUI, is one treatment option that we offer to women in their 20s, because it's the least invasive method of fertility treatments. And it doesn't require a lot of hormones. It doesn't require a lot of medication. It doesn't require harvesting the eggs from the ovaries. It's very, very minimally invasive. But again, we offer it to women who cannot get pregnant on their own at the age of 25 to maybe up to 30, because after that, the chance of success will be very, very minimal with IUI. IVF, in vitro fertilization, ICSI, it's the standard mode of treatment when you're considering using your own eggs and own sperm samples. So this is a treatment option for people maybe in their late 20s, early to mid 30s, maybe late 30s, who are not able to fall pregnant using their own eggs and sperm cells in natural conception, because there's probably some sort of an ovulation problem, or maybe the sperm count is a little low, so it's not sufficient for a natural conception. So what we do is we assist the couple in the laboratory to combine the egg and the sperm cells so that we can fertilize the egg with the sperm cell and place it in the uterus for conception to take place. So essentially what we do is we something that doesn't occur naturally, which should, but it doesn't. So we help it in the laboratory environment, and we put the egg and the sperm together, create the embryo, and then we place the embryo in the uterus so that pregnancy can be helped. We do have other options, for example, especially women in older age brackets. In today's world, women are also climbing the job ladder. They are spending time on their careers. They are delaying their reproductive age in a way. So for these groups of women, maybe they're planning their pregnancies in the after their 40s, 42, 43, 44. But this is also a time where their reproductive function has gone significantly down. And in some cases, they're not able to achieve a pregnancy using their own eggs. So in more advanced age brackets, or women who are younger but who have entered menopause prematurely, this is something that we are able to offer them. We use donor eggs during an IVF cycle. So a young and pregnancy-proven healthy egg donor donates her eggs for the couple so that donor eggs can be used during the IVF cycle. There are options like tandem IVF cycle, where we use both the eggs of the patient and donor eggs as well as backup, especially when they're considering that their eggs may not work so well. Ovarian PRP treatment, just as I mentioned a few minutes ago, it is one of the new out-of-the-box treatment options that we offer. It is offered mainly to stimulate the primordial follicle line so that we can commit those primordial follicles that would actually go to waste in a normal natural cycle. We commit them into oogenesis. We commit them into becoming oocytes, becoming eggs. So we do increase the chances of getting pregnant either naturally or with IVF in the subsequent months. IVF using donor sperm, again, azoospermia is a problem for many men, and it's the main cause of infertility. especially if it's non-obstructive azoospermia, meaning that there is no production of sperm. So it's not the blockage that's making sperm not enter the ejaculate, but it's actually something more fundamental. The production of the sperm is problematic. Then there is that option of using donor sperm. We only use donor sperm from certified sperm banks. So we do not allow walk-in sperm donations because they have to be certified, and you have to be able to provide some sort of a guarantee that the sperm cells have been extensively tested. PGT, pre-implantation genetic testing, is available for a number of options. For example, in older age brackets, maybe you do want to screen the embryos for a genetic disease such as Down syndrome, Tau syndrome. So there are a number of chromosomal anomalies that can be screened with PGT. And it's also used for known single gene disorders. So if there is a known single gene disorder in the family, and you want to make sure that your child doesn't have it, doesn't get that genetic disorder, doesn't inherit that genetic disorder. So you can screen that specific gene mutation and only transfer the embryos that are healthy. And also, family balancing is an option, because when you're screening the chromosomes, when you're doing a chromosomal screening, you also see the sex of the embryo. So for family balancing, if you have a couple of girls and you want a boy, if you have a couple of boys and you want to have a girl, that's always an ethical discussion. But in certain parts of the world, it's important to have a balanced family. And rather than going through abortion, I think it's a much more sensible option in terms of balancing out the family, if that's something that you would like to do. And finally, gestational surrogacy is something that is being offered in Northern Cyprus within certain legal limits. It's only offered to women who cannot carry a pregnancy. Either they don't have a uterus, or they have an underdeveloped uterus, or the uterus has to be removed due to any condition. So it requires that a heterosexual couple applies and the woman is not able to carry the pregnancy. So these are the terms of gestational surrogacy. So again, just to sum up, why fertility treatments in North Cyprus? Because of the cost advantages. The cost of treatment in North Cyprus is much, much lower compared to Europe, compared to the US, and many, many other countries. And you are able to receive out-of-the-box treatments because we cater to international patients, because we have to remain competitive. We do have to offer innovative approaches. We do have to offer a higher chance of success. So people hop on the plane and prefer you as opposed to going somewhere local or going somewhere in any other country. So you have to be very competitive. You have to be able to offer high chances of success. To be able to do that, you have to keep on top of your game and be able to offer innovative research and technology. In terms of legal coverage, everything that I have mentioned in terms of the treatment options, they're all perfectly legal and offered legally. And our donor base, that's one of the reasons why IVF with egg donation is quite successful in North Cyprus, because we do have access to a large donor base. It's on a voluntary basis, and mostly because there's a lot of international students here in Northern Cyprus. The egg donors are often between the ages of 20 to 25, so they're quite young, quite healthy, and on a voluntary basis, they are able to donate their eggs to recipients. So that means we're able to provide young, fresh donor eggs to our recipients, increasing the chances of success. And accreditation is another important aspect. All of the hospitals, most of the hospitals, let's say, are accredited with ISO certification. So I'm leaving you guys with a picture of the Kyrenia Castle and thanking you for the time, and I appreciate the time. So in our further talks, I'll be talking about specific treatments in general.